Could malnutrition leading to death for a patient in ICU, as shown in the coroner's report, be directly attributed to the failure by the ICU to provide adequate PEG feeding? That's a question from one of our clients as part of a medical record review, and I will answer that question today. My name is Patrick Hutzel from intensivcarehotline.com, and this is another quick tip for families in intensive care. So again, this is a question: could malnutrition leading to death for a patient in ICU, as shown in the coroner's report, be directly attributed to the failure by the ICU to provide adequate PEG feeding? So, of course, malnutrition leading to death, as documented in a coroner's report, can be directly attributed to the failure by the ICU providing adequate PEG feeding if the evidence shows that ICU staff didn't initiate PEG feeding when it was medically indicated or delayed it without justification, failed to administer the appropriate amount of nutrition through the PEG tube after it was placed, didn't monitor or respond appropriately to signs of malnutrition or nutritional deficiency, such as weight loss, lab markers, or visible deterioration, ignored or failed to address PEG complications like clogging, leakage, or infection that interfered with proper feeding in a hospital and ICU setting. Once a PEG tube is placed, the medical team has a duty to ensure it's used correctly and the patient receives the required calories, fluids, and nutrients. If that didn't happen and it contributed to the cause, death, that could be considered medical negligence or even medical malpractice, depending on the circumstances. And, we have worked with so many clients over the years, where ICU sometimes refuse nasogastric tube or feeds or PEG feeds when a patient is intubated or has a tracheostomy. That's just the unfortunate reality. And as you can see, it is actually medical malpractice and medical negligence, and you can argue on that level. I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that if you go to our intensivcarehotline.com testimonial section, or if you go to our intensivcarehotline.com podcast section, where we have done client interviews, and you can see the testimonials and the podcast interview with clients at intensivcarehotline.com. Because our advice is absolutely life-changing. When we look at medical records, when we talk to doctors and nurses directly, when we set you up with the right questions to ask, when we give you that critical second opinion, we change your perspective. And you will be moving away from the doom and gloom and negativity that ICU teams are giving you to very clear strategies that will help you to make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years. And there's hundreds of them. That's why I do one-on-one consulting over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. I talk to you and your families directly. I talk to doctors and nurses directly. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivcarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. You also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, and influence. And all of that you get at intensivcarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivcarehotline.com with your questions. And if you like my videos, Subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivecarehotline.com email newsletter at intensivecarehotline.com, and share the video with your friends and families. Thank you so much for watching. Take care, and I'll talk to you in a few days. Take care for now.